Yep.
Okay. My name is Megan and I'm a student at the University of St. Francis, and today I'm going to do the baby head to toe assessment. First I'm going to check the ID of the baby. Checking it with the electroconical MAR. Next I'm going to check the vital signs, temp first, underneath of the arm. The normal temp should be 97.7 to 99 degrees. Next I'm going to check the pulse of the baby. Normal pulse should be 100 to 160. Next I'm going to check for respirations above the nipple line and on the side of the abdomen, and normal respirations to between 30 and 60. Next I'm going to check for heart sounds just to make sure they're regular and unlabored, and bowel sounds in all four quadrants, making sure that they are active. Next I'm going to start at the head, taking the hand off, making sure that it is circular and checking to see if there's any molding, checking the fontanelles to make sure that they're soft and flat, checking the caput succedaneum, that it crosses the sutures and is soft and a little swollen, and then the cephalhematoma, which is on that one side and does not cross the suture line and is firm. Next I'm going to check the face, checking for any myela, which is the white pimples, which are usually found across the nose, which is normal. And then the eyes, making sure that they are evenly spaced and there's no discharge coming from them, no redness, and that they're not hemorrhaging. And then checking the epiphyseal fold on the inner eye. Next, checking the ears, making sure that they are midline with the eye. If they are not, it could indicate Down syndrome. Folding the ears on the top of the ear, making sure recoil, and then on the bottom ear for recoil. Checking the nose for patency, holding one side of the nose in, checking to see if the baby is breathing, and then on the other side, making sure that it is clear. Next, I do put gloves on. For checking the mouth, checking the palate to make sure that there is no holes or anything, and then putting my finger inside and seeing if the baby is going to suck on the finger. Next, with 2 fingers, checking the neck to see if there is any masses and doing a range of motion with the neck. Also checking the clavicles to see if there is any dislocation of the clavicles or breakage that may have happened during birth. Next, checking for jaundice in the 5 areas of the eyes, the forehead, the abdomen, and the chest. I would also check for respiratory distress. The 5 signs of respiratory distress are retraction, nasal flaring, grunting, apnea, and seesaw respirations. I would then check for the abdomen, checking to make sure that it is soft and round, and looking at the cord, and it is in its drying state right now. I would also be checking the skin the whole entire time I'm doing the assessment, checking for bruising or any peeling anywhere on the skin. I'm going to check for turgor on the inner thigh, pinching the skin and seeing that it recoils back. Next, I'm going to be checking the genitalia. This is a female baby. The labia majora should be covering the labia minora. The clitoris is epididymis, and there is no discharge, but if there is a white little discharge, it is normal and you can just wipe it away. If this was a male, the penicle shaft would be the center of the meatus, and there would be rugae on the scrotum. Next, checking for tone and recoil of the arms. And I would grab the arm and bend it and watch the arm come back. And when I let go, the arm should go back by the baby's mouth. Next, checking at the palms, making sure the baby does have 10 fingers, and checking for the creases. One singular crease could indicate Down syndrome. Then turning the Then looking at the baby's feet, checking for creases. The creases indicate maturity. And checking the Babinski reflex by making a backwards J starting at the heel and making my way towards the toe, watching for the baby to flex their toes. Next, I'd be looking for on the spine of the baby, looking for any dimples. And any hair on the spine, making sure that the hips are even by looking at the cheeks of the bottom, and checking the Moro reflex. By doing this, I could clap my hands and it would slightly startle the baby. The baby is awake, and the last time it would have voided, it should have 1 stool and 1 pee within the first 24 hours. And that's it.